It's really understandable that you have concerns about your child taking inhaled steroids, as most parents do, but it's important to remember that these inhaled steroids are safe and effective if taken in the correct way, either using a spacer or a device that your healthcare professional chooses with you for your child. The medication will go straight down into the lungs. So the benefits to your child of taking the regular inhaled corticosteroid every day in the correct way far outweigh the risks. A small number of children may get side effects such as a sore throat, a hoarse voice or a sore tongue if they use a preventer inhaler regularly. However, you can reduce the risk of side effects by making sure your child always uses their spacer correctly, by making sure that they rinse their mouth or brush their teeth after they've used their inhaler, and also if they have a face mask attached to their spacer, to wipe under the face mask with a damp cloth around the mouth area after they've used it. It's so important that you take your child for their regular scheduled asthma review with a doctor or nurse at least every 6 months, that they can check the dose your child's on and check that it's the lowest dose possible. Although there is a link between inhaled corticosteroids and growth, research shows that children who have asthma that is poorly controlled is also likely to impact on their growth. It's really important though that at your child's asthma annual review that your child has their height and weight checked, and your doctor or nurse will plot that on a growth chart to make sure that they're reaching their milestones. It's understandable that you have concerns when your child is taking inhaled steroids, but one reassuring piece of research shows us that a child who is taking a typical dose of budesonide, 400 micrograms regularly, will have an average of 1.2 centimetres reduction in their adult height. So in other words, the impact of inhaled steroids on growth is really small, and it's much safer to make sure that your child is taking their inhaled corticosteroid regularly to reduce their risk of a potentially severe or life-threatening asthma attack. Your doctor or nurse will only ever prescribe steroid tablets if they feel that your child really needs them. They're a really fast, effective way of taking down the inflammation that's in your child's lungs. We know that some people are concerned that their child may gain weight, that they've noticed that maybe their child is hungrier when they're taking steroids. If you're taking steroids in the short term, this really should pass when the steroids are stopped. However, if you're taking inhaled steroids in the long term, it's really important to make sure you follow all of the usual advice and make sure the child is eating healthily, a well-balanced diet, and at the asthma review, make sure your child's weight is monitored by your healthcare professional. Some people do tell us that their children have mood swings, difficulty sleeping, or they just notice differences in their children's behaviour when they're taking steroids. So to reassure you, the side effects will only be very short term and will only last for as long as you're taking the tablets. If your child is taking steroids in the longer term, please bear in mind that most of these children don't experience side effects. And please remember that you can call our helpline to speak to one of our friendly asthma nurse specialists.